enter the room.
Hello.
Hello.
Hi. I'm Bushra. I'm one of the doctors in this department.
Hi, doctor.
Hello. Hi. Can I confirm your name, please?
Yes, absolutely. My name is Danielle.
All right. What would you like me to call you?
Danielle is fine.
All right, Daniel. I understand that you're here for your son. Is that
Um,
correct?
that is right. Yes.
All right. Can you confirm his age and his name for me, please?
He's Rick, and
His name is Rick, and he's 2 years old.
he's 3 years old.
All right. All right. Thank you for letting me know that. So, how can I help you today?
Oh, well, doctor, I'm a little concerned about the flu vaccine that my son is scheduled for. It's
Oh,
coming up next week, and
mhm.
I just want to know everything about it.
Okay, okay. Well, I'm surely going to help you out in that regard. All right.
Mm-hmm.
But before that, I'll be needing to ask some questions about your son's health. Okay.
Sure, sure, absolutely.
All right. So, can you tell me what is your understanding about the flu vaccine?
Um, Well, not much really. I'm a little concerned about this vaccine because a neighbor's kid recently got the vaccine and started having fits after it. So I want to know exactly what this vaccine does.
Okay. All right. I can see that you're concerned about it. Okay. I'll try to address your concerns. Okay.
Mm-hmm.
That, apart from that, can you tell me if your son is he regular with his jabs, the previous vaccinations schedule?
Yes, yes, yes. He is up to date with that. In fact, last year also he got one flu vaccine.
Okay, he got one. All right. And did he had any kind of any complications, any other symptoms after the vaccine?
I mean, he just had a slight fever, but yeah.
Mm-hmm. That's about it. Okay.
Mhm.
All right. And by any chance, is your does he have any medical condition that he's diagnosed with?
No, doctor.
Any allergies, particularly any egg allergy or any medicine allergy you might have?
No, not that I know of.
Okay. And any medication that he's on currently?
No, not really.
Okay. So, apart from this, can you tell me if how was his birth like? Was it a natural delivery? Was it a cesarean section?
It was all right. It was natural. It was all natural and it was all fine.
Okay, there was no complications during the delivery? There
No,
weren't any complications?
no doctor. There wasn't any.
Okay. All right, that's good. And are you happy with the red book and the development of your child?
Yeah, he's doing great. He's pretty happy and
Mhm.
cheerful.
That's great. That's great. And is he gaining weight and is getting height properly?
Yes, yes, he is. Absolutely.
Okay, that's great. And how is he doing at the moment? Does he have any fever?
No, not really.
Any rash?
No, no issues.
Okay. And okay. So you told me that's reassuring. You told me that he has been given this shot before, and this is his second shot of flu, right?
Indeed. Yeah.
All right. So let's discuss about what a vaccination is. So a vaccine is a substance that is injected in the body to produce immunity, all right? To generate some cells that will fight infections, any complications of infections that can happen in the future.
Yes,
All right?
doctor. We know about what vaccines are. I'm really interested to know about this flu vaccine and why does he have to get it every year?
Mm-hmm. Yeah,
The
so
other
you know
gets it
yeah,
daily.
so basically the The children, their immunity is not developed completely, and there's a certain type of virus, that is a flu virus, and it can have some complications if the immunity is not that good. It can lead to pneumonia as well. It can affect the functions of the body as well. So in order to prevent that, that's a general advice that a yearly flu vaccine is recommended for children. Okay, does that make sense to you?
But why give it early? Why isn't any other vaccine given early?
Well, this is the most common viral illnesses that can happen, and it usually happens at the time of the cold weather. So most likely, we prefer it to be given every year, so the antibodies are formed yearly. That's why.
Okay, yeah, sure, that makes sense. Fine.
Okay, and
Hmm.
well, you were concerned about
2 minutes remaining.
you were concerned about your neighbor's child. I suppose that was having fits after he got the vaccine, right?
Yes, yes.
Yeah, so basically there is no relationship between, the vaccine and the fits most likely. Must have been having any fever and the fits were due to the fever. But obviously we are not sure at the moment. As of now, there is no study or any kind of research that suggests that the vaccine has any relationship with the fits. All right, so let me reassure you regarding that.
All
Does
right.
that make sense?
Yeah,
Okay.
sure. And can he get sick afterwards, after he gets the vaccine? I'm a little worried about
Well, there are certain side effects. It's more like a minor fever, just like he had last year, some fever or local swelling at the site of injection, and some redness maybe. But it will be for a few days, and it will be fine after that. Okay, so you
that.
don't have to worry about
Okay, okay.
it. Okay.
But this time they gave it through the nose. I mean, what do you mean? Is it going to be an injection this time?
Sorry.
Last time they gave it through the nose. They put some drops in his. Will they be
Oh,
giving him an injection this time?
oh no, no. They're going to give the shot. They're going to give the from his nose. Yes. Same
Okay,
way, that they gave from last year. They're going to use the same technique, the same way that it was the last year. That's the one way that we give the vaccine.
I see. I mean, is it compulsory to have it?
Well, it's highly advisable to have it, but it's not mandatory. So it is your decision at the end of the day, and we respect it totally. But it's highly advisable from our side because it does prevent any complications.
Move on to the next station.
Thank you so much, Dr. Bushra. Good job. All right, let's talk about flu vaccine, guys. This is one station that I've noticed has been coming quite frequently. So it's an open question to the group out there. You guys understand by flu vaccine? Like, what type of vaccine is it? Anybody? Dr. Bushra brought up a lot of good points. But apart from that, what is your understanding? What's your baseline understanding of flu vaccine? What sort of a vaccine is it? Anybody? No comments. It's such a difficult topic, right? You guys, if you are shy to talk on the call, you guys can drop in your comments as well. But anybody for what you think of, flu vaccine? What type of vaccine? Nope, nothing. All right, no problem. So, flu vaccine is actually a live attenuated vaccine. All right. And what do you guys know about this live attenuated vaccine? Anybody has any understanding of live attenuated vaccine? So another live attenuated vaccine is MMR, and MMR is actually given twice. And the other one that we know is BCG, and BCG is given only once. But why is flu vaccine given on a daily basis? Like, I mean, on a yearly basis. Like, flu vaccine is the only vaccine that we give on a yearly basis. Anybody anybody can take on this question? No, no response still.
Well,
Hi, Dr. Farao. Go ahead, Dr. Farao.
right.
Uh,
Well, I
yeah,
think it's of the seasonal peaks in flu infections, maybe particularly during the winter season. So it has to be given yearly, and also because of how the virus can garner resistance at each and every time.
Absolutely. I think I would give more importance to the second part of that answer. So basically, the flu vaccine actually provides immunity against the influenza virus. So what do we know about the influenza virus? Influenza virus, the H1N1 viruses, they actually, influenza A and influenza B. So there is 2 strains of influenza A and 2 strains of influenza B that it gives protection against. Viruses have a very high chance of mutation. So the whole genetic shift, antigenic shift, antigenic drift, if you guys know. So the influenza vaccine, influenza virus has this incredible way of, fooling the immune system by just developing a few, antigens, or just modifying its antigens so that it, it can evade detection. So every year, they actually experiment and bring about the different components of this virus. So the latest strain that is actually available at the moment is the component of vaccine that is given. So every vaccine, every year that you receive the influenza vaccine, it's not the same vaccine. All right, there are certain modifications every year that is made to it. That is why you give it yearly. And it is a live attenuated vaccine. So that means live attenuated vaccines are the ones that have the best kind of immunity. All right. So if you see BCG, it's actually taken only once, right? So I mean, it doesn't have a seasonal shift in anybody from an endemic area where TB is endemic to their areas. You might see that you only get BCG once, but why is it that a live attenuated vaccine like influenza, why do we need? So that is a very interesting and important question, to think about, right? So we understood that it's a live attenuated vaccine. So what are the things that you need to think about when it comes to live attenuated? So remember, it's live and it's attenuated. So that means it's just weakened, but it's still alive, right? So you have to make sure that the child or anybody you're giving a live attenuated vaccine is not immunocompromised, number one. And number two, you can't give a live attenuated vaccine to a pregnant person. All right, so these are the absolute contraindications that you guys need to keep in mind. All right, so now let's talk about influenza vaccine, right? So what exactly should be thought about when you're giving influenza vaccine? So number one, definitely you have to think about any past medical history that this child might have, right? Especially any immunocompromised state or asthma. So these vaccines have a chance of increasing wheeze and therefore bronchospasms in people with asthma. Right, it's a relative contraindication. You can definitely take measures against it. But contraindicated immunocompromise, absolutely, Dr. Jibber. Thank you so much for answering. Dr. Sana saying it's a difficult topic. That's why no one's replying. Oh, it's okay. Vaccines are usually very difficult, but let's simplify it for all of you. So, so the one thing about we spoke about the live attenuated and why this is given yearly, and second is about the contraindications. So when it comes to medication, okay, let's give you a scenario. There is a patient who is being treated for Kawasaki's disease. All right, would you give this, and is the child's flu vaccine is coming up within a week. Currently he is on active treatment for Kawasaki. So would you give this person a vaccine for flu? Oh, Dr. Jabber is saying no. Yes, absolutely, you will not give the vaccine, because one of the major complications for people taking high dose of aspirin or aspirin in general, especially if they get a viral infection like chickenpox or flu infection, they can go into something called a Rice syndrome, right? Anybody taking aspirin, if they get viral infections, they may end up getting Rice syndrome. And Rice syndrome is basically the interaction of these viral viruses with aspirin, and they cause a whole lot of problems in your liver as well as your brain. So it causes some fatty deposition in the liver and even brain swelling, edema, whole lot of things, right? So two things when you're thinking about giving the influenza vaccine is, number one, are they immunocompromised, Or do they have asthma when it comes to medical history? When it comes to medication, are they on any steroids or any aspirin? You know, two things you have to think about. Like steroid means immunocompromised, so you don't want to give it to them. And if they are on aspirin, this is very specific for this particular vaccine. So do keep that in mind. All right. And thirdly, the other allergy that you need to keep in mind. Dr. Bushra very nicely asked questions for it. But what do you think about the other allergies? What are the other things that other contraindicated allergies that you need to keep in mind before giving this vaccine? Anybody? Dr. Chido Chashi, am I right?
Yes.
Okay.
So if I'm not wrong, the flu vaccine is made with something egg related, so an egg allergy would be a contraindication.
Absolutely. Egg allergy. And any other allergies that you can think of?
Neomycin.
Neomycin, amazing. Yes, but neomycin is an antibiotic. Why would it be contraindicated? All right. So this is the same concept. So three things basically you need to keep in mind: gelatin, neomycin, and egg. So these are components that are used in developing this vaccine. Sometimes while developing this vaccine, they actually make sure that it's not infected by anything else. So that's why they're in the manufacturing process, there is a process where they will actually be treating it with neomycin. So it might have some components of it. So these components are actually used in manufacturing the vaccine. That is why if you have any allergy towards it, the vaccine becomes contraindicated. Yeah, I hope this was clear and you guys are, clear with this whole explanation for flu vaccine. Otherwise, everything was great. I think you were able to handle all the other questions. That was nice. And so this is a vaccine that is given from the age of 2 to 17. All right. So this is a person who is right now receiving it at the age of 3. And this mother always said, yeah, 2 years also, he kind of had the same vaccine itself. Why do you want to give it every year? And this is the live attenuated vaccine is something that is given nasally, 2 drops nasally. So that is how you administer this vaccine. And there is no other, needle related problems. And they may develop a mild fever that may last to a maximum of 3 days. 2 to 3 days they maximum last, but it is very what we'll say, it's of a very mild grade, right? So it will pass soon. All right. Any other questions related to flu vaccine? Anybody who has any thoughts they want to share? Anything else? Is this topic clear? This is a very high yield topic that has been repeatedly coming. So anybody, any other doubts on this topic? Otherwise, don't worry about it. We are going to, do this case again. So Dr. Bushra, are you ready for another turn?
Okay, sure.
Oh, yes. Before we go to the next turn, let's just quickly look at the checklist. One moment. I'll just quickly open the checklist and we'll take a look at that. For everybody else who is on the call, guys, go ahead and, answer the quiz. I hope you guys have, okay, I'll just post the quiz again, right? So that we'll know who is next on the thing. And okay, yeah, Dr. Jabber has written something about, yes, has written a few things about race syndrome. Thank you so much, Dr. Jabber. You guys can also quickly check out the, the comment that Dr. Jabber has dropped. Very good. All right, let's just quickly look at the checklist. All right, here you go. So confirm the patient's full, confirm the parent's full name and the relationship with the child and the child's full name. This is very important, Dr. Bushra, especially when you are talking to anybody about any condition or their, medical data. You have to make sure that the person you're talking to is the right person. And for your information, candidate information, you were given the full name. So always clarify the full name and age. These are the information that you need to make sure to have full name. Even when you're documenting that you've had this conversation, you have to document the full name, right? So never go wrong with the identifiers. If, every time ask for the full name and confirm the age, because these are the 2 identifiers that have been given to you. And if it's for a video call or a telephone conversation, identify those one extra identifier in the form of address, first line of address. So do always make sure to do that. All right. Otherwise, establish the reason for the visit and elicit the specific concerns regarding flu vaccine. Yes. Ask about any recent symptoms. This is another contraindication. If the child is currently unwell, you do not administer any vaccine. All right. You actually postpone the administration of vaccine. So good job. Ask about past medical history, especially asthma or recurrent wheeze, right? Or any immunocompromised state. Inquire about any drug history, particularly long-term steroids or aspirin. Explore, I think I'll give you a yes for this. Explore allergies in detail, egg, gelatin, neomycin, right? Potential components, vaccine components. Inquire about pregnancy and birth history, vaccination history, developmental history, confirm if the child has been meeting milestones normally. That was very good. But one thing is there that when you reached management, Dr. Pushra, it was already only 3 minutes left. So every question that you're asking, you're always repeating it with another follow-up. You know, are you currently, do you find that you're okay with the red book? Is he developing properly? I mean, by answering that in the first go itself, you're getting the answer. You know, you don't have to follow up with another question. You're wasting time. You did a lot of data gathering, right? And that is not necessary because this is mostly a counseling station where you're trying to counsel them about, you know, what these medications are, what are the contraindications, what you should keep in mind, right? So dedicate more time towards management. Right, over here you're trying to rule out any contraindications, and you know, since you know that he is 3 years old, you know, keep in mind that he might have got this you know, a vaccination beforehand, right? So anybody past the age of 2, you know, think about asking them, have they received the vaccine before? Because this vaccination actually starts from the age of 2. So always keep that in mind, 2 to 17, right? So if this patient happens to come with a child of 5 years of age, that means keep in mind to ask them whether they have received it before. This is an annual vaccine, so every year they will be receiving, especially during the winters where it's more common to get the flu infection. All right. Yes. Confirm Daniel's understanding of the flu vaccine and Rick's health after the first flu vaccine and address any specific concerns. That was good. Assess general well-being, ask about feeding habits, growth, behavior, and weight gain. Yeah. Explain the nature of the vaccine, live attenuated nasal spray that is safe and does not cause flu, right? So, you know, you may actually use the word, do not use any medical terms like live attenuated, you know, that way it would be considered as jargon, right? Definitely try using more simpler words, you know, it's live but weakened virus, right? So, and then go ahead with the explanation. Discuss the benefits of vaccine prevention of complications like pneumonia, bronchitis, and ear infection. These are common related infections that is caused by you know, flu. But let's talk about fits. So do you think flu vaccines can cause, I mean, flu infection can cause fits? Anybody? Come on, guys, this is an easy one. Yes, they may. I mean, if the fever goes, you know, really high, they may end up getting febrile seizures. And most of the febrile seizures are usually viral infection. Not really. Okay. Well, it depends upon how high the fever is, right? And sometimes even with the flu infection, you actually can get fever. So it could be that that other child might have gotten, exactly, Dr. Jabbar is saying febrile as well. So it could be that that child must have gotten, you know, infection, and it could, you know, the fever must have gone really high. Yeah. Oh, Dr. is saying that viral infections, febrile, not viral. Yes. Yeah. So viral infections, there is no evidence suggesting that vaccines cause fit. Yeah, yeah, absolutely. Vaccines don't cause fit. You know, there's no direct evidence, but we are looking for any infections who after post-vaccine, you may get like a mild infection, but those infections don't go that high. So, you know, it's very unlikely it's very good to use words like very unlikely, dancing, of course not. All right. And say that at the moment, we do not have any current evidence with any relationship of any vaccine having seizures, right? There may be one or two case studies that might be coming up in the future. You never know. So it's very good to use the words very unlikely. All right. And most of the time when you're talking about fits, you can say along the lines of, if the fever happens to go anything, beyond a certain limit, there is a very high chance that children, especially developing children, end up getting fits. It's called febrile seizure. All right. So otherwise, clarify that vaccines, clarify flu vaccine does not cause fit, and there is no evidence supporting a link to such severe reaction. Clarify common myths, address fears about seizures, fits, and assure her that the side effects are very rare and usually mild, right? Highlight the importance of a yearly vaccine due to change in circulating flu virus strains. Emphasize on non-compulsory but highly recommended nature of flu vaccine for children from the age of 2 till 17. Reassure regarding safety, especially in the context of previous vaccination and lack of risk factors. So this was important. So, especially since the patient has already gotten the vaccine before and, it doesn't look like they have any risk factors. So reassure them a little bit, right? And 3 things that we always tell everybody to do in management. This is very important that you guys actually somehow incorporate these 3 aspects to it, management, which is offer leaflets, because you want them to refer to legit sites, legit sources, rather than believe in myths. So the one way you can actually popularize the legitimacy of sites is by actually offering leaflets, right? Offer leaflets, provide safety netting just in case if you do feel that the fever persists, there is cough, there is prolonged symptom, seek review if they occur, right? And offer follow-up. Invite her to return or call the surgery if more questions or concerns arise. Okay. Okay, so acknowledge Dania's concern and validate her feelings and reassure her that many parents share the similar concerns. So normalize the situation of actually asking questions. That's a very good practice. Okay. Use empathetic phrases like, I understand your worries and it's normal to be concerned about vaccination. Summarize the discussion to ensure understanding. Use simple language and avoid medical jargon. Encourage questions and provide concise, clear, concise answers. I will give a partial for this. Show patience and understanding. Maintain calm and supportive tone to build rapport and ensure she feels heard and respected. Use empathetic statements. I completely understand why you'd be concerned. It's perfectly natural to want what's best for your child. Yeah. All right then. So that was your first attempt. So good job, guys. Let's go to the next round.